is present. I have 8 members.
Thank you, Madam Secretary. And I want to thank all the members from your busy schedules to be here today. And I want to thank all the committee members for your attendance. Before we get started, just kind of recap what we've been talking about. And I know the department has been reaching out to several of the committee members. Hopefully everybody is. At the last meeting, we basically talked about maybe some structural changes, maybe some goals within the department, short-term and long-term goals. And what this committee is going to do is we'll try and meet every 6 weeks to talk about how we're accomplishing those goals, how we're moving things forward, how we're logistically moving forward. So the department has provided for you a binder of structural recommendations with timelines and also articles involved in there. So just to let you know, this binder will be added to as we have committee hearings. So if you want to keep your binder here, the Senate staff will be happy to add to it. If you want to take it home and make sure you have it as a reference point, it's there for you. So members, what we'll do is, once again, this is a working meeting. We're not working on any kind of legislation, so we're all probably on the same page as far as wanting to move this thing forward. So what we'll do, y'all, is we'll hear from the department. We'll hear from not only their recommendations, but their timelines and logistically what they're working on. And when they do work on it, how it's moving the needle for the safety and health of the children and the people in Louisiana that we care so much about. But once again, let's make it a free-flowing conversation. So if, as we're talking about anything, you see something that brings up that you want to visit, I'll be the moderator, and we'll just keep this thing going. So if it's okay with everybody, we'll start off with the department first. They'll talk about where we've been from the last meeting to now, what we've accomplished, what we've maybe not been able to accomplish, and then we'll just open it up to everybody, and we'll go from there. Is that okay with everybody? Well, Madam Secretary, you and your team are ready to go.
Thank you so much, Marquita Garner-Walters, Secretary for the Department of Children and Family Services. And members, we've had an intense 6 weeks since we met with you, and we have mobilized to attack what we believe are our 3 biggest challenges: the staff shortages, the rising and complex caseloads that we face, and the staff frustration with the working conditions and environment. So today we're going to talk about how we're addressing those things, and I'll get into the binder in a little bit. But it was clear in the summer that we were headed for a perfect storm with these realities. We were losing staff, the caseloads were crippling. As you know, we've said that over and over. And it was clear that we weren't going to be able to do our day-to-day operations the way we had always done it and be successful. Employee satisfaction plays a huge role in our work, and we recognize and acknowledge that we have staff that are unhappy, that feel like they have been treated unfairly, and have not had the opportunities that they should have had in this agency. And we are addressing that in many different ways. I mentioned to you, I believe last time, that I have asked Deputy Ricks to lead an effort that we're calling the Culture of Belonging. And she's going to share about that in a little bit. Last time we were here, Senator Cortez was with us, and he challenged us to open our thinking and to he used the words of Jim Collins in Good to Great, and get more people on the bus. Get more people in the door. Look at how you're recruiting, look at what your qualifications are, and get more people in the door. And we took that to heart, and we're going to share more about that as well. We shared with you the 7 strategies, and then I believe at the end of the week we mailed you some detail behind those strategies. I think in the hearing we just gave you the actual strategy list, and then we gave you more information after that. We believe that these strategies, at a minimum, are what we need to stabilize the workforce and to address the issues that are facing us, and will give us milestones to achieve that you can hold us accountable to and help us work toward. In looking at those strategies and looking at how big of a scope of work that was, it was really clear that we were going to have to make some changes to be able to do just the day-to-day operation of the organization and focus on those 7 strategies. That was way too big of a job or path for one person to do. So we had a long talk, long conversation, a lot of conversation about what the best strategy to do that was. And Dr. Hodnett is our expert and has been with us and knows this agency inside and out, and so we want her to have the opportunity to focus on the 7 strategies. So we brought back, and I want to emphasize that, this is a former retired child welfare director that loves this agency and was committed to helping us do better. And so Evelyn Jenkins has come to join our staff and will run the day-to-day operations while Dr. Hodnett focuses on the strategies. You'll get to hear from Evelyn a little later. It was also important to us members, especially based on what Senator Cortez said, that we needed to work with civil service to look at the qualifications of how we get people in the door, of how to hire more quickly, excuse me, than our normal hiring process. Our normal hiring process is bureaucratic and laborsome. And so we have been working very closely with the Civil Service Commission. In fact, they're here with us today to look at what our process is, how we can streamline it, how we can tighten it up. And in fact, we're meeting weekly with the governor's office, the Division of Administration, and Civil Service, bringing every effort to bear to make this a more streamlined process and to bust down any barriers that the agency was facing. I can't emphasize how much help that has been. We even have the National Guard helping us, and we've never had the National Guard help us outside of disasters, and so they are excellent strategists, and they are sitting at the table with us, helping us think through these strategies, and so that has been a remarkable gift. One of the things we've been able to do because of this is break down some of the time that it takes to move contracts through the process. Again, that's a kind of tedious and laborious process to move contracts. We have been able to execute in the 6 weeks since we met with you 10 contracts for additional services, and that are going to give us help in Baton Rouge and New Orleans. You remember, excuse me, members. You remember that we are using Baton Rouge as our pilot site, and New Orleans kind of in conjunction with that, and then we hope to move all of these things statewide. But we really have to focus where the need is the greatest, and the fire is still burning in Baton Rouge, and so we are using Baton Rouge as that pilot. One of those contracts, or actually 3 in one of those contracts, is an employee assistance program, which our agency has never had, that will serve the Baton Rouge, Lafayette, and Lake Charles areas. That is a region for us, and that's why we chose to do it that way. And we have providers that came to the table and wanted to partner with us and wanted to do that. Those contracts are now in place, and that has started to give our staff the emotional and mental health services that they need. A few weeks ago, kind of in the interim after our meeting, we mailed you a timeline. One of the things you asked for was a timeline of how we thought we would do this. The timeline is also in your binder, and we can go through it. I know it's little and it's kind of hard to read, and so we're happy to walk through whatever pieces of that you want to do. The binder itself, I'm not going to go through it with you, but it has, in the very beginning, is the transition team report that was done for Governor Edwards as he took office. That report was very harsh about the condition of DCFS, and so when I was hired, the governor said, I want this to be your template for how you do your work. And so all of the recommendations, so you have the transition team report, and then in blue ink under each recommendation by that committee that did the report, you have the answer of the DCFS response, what we have been able to do through up until now, because we updated it. Senator Barrow was familiar with this as a member of my advisory board. The advisory board has been tracking this transition team report with us for several years. I don't know that any of the rest of you have had the opportunity to see it, so that's why we included it. And it also gives you a good overview of all the things the agency walked in the door and needed to address, and how successful or not we were in addressing them. And then there are the 7 strategies that you have seen, that we have given you, and then the timeline that we mailed you. And then, members, under the 4th tab, there's a continuum of care. This is a basic child welfare 101. You're going to know a lot of this information. And at the bottom of each page, what we did was break down, you know, sometimes we talk about child welfare like it's just one big lump of clay. And child welfare has very specific strategic components, like intake, like investigation, like foster care. And so this breaks down for you all of those things. It gives you some information about how we staff those, and it gives you a little bit of data or trend information. And then finally, it gives you some policy information if we've made any policy changes in the past few months. And it shows you how it aligns with the 7 strategies. So we will, as the chairman said, we will be adding information to this. There is also, under the 5th tab, all of the contracts that we have done thus far, where they are, the ones that are in the pipeline, what's pending, what's approved, and what they'll be doing. Again, remember that most of these contracts, although we hope to go statewide, are beginning in the Baton Rouge region. Before I ask my colleagues to speak, I want to hit a couple of more points. Recruiting and job fairs have been really exciting for us, and we have a handout for you. There's one tomorrow in New Orleans if you want to be able to go to that. We have held 2, one in Baton Rouge, one in Lafayette, but the attendance at the job fairs has been really significant. We had 150 people in Baton Rouge and 180 come to Lafayette, which gives us hope that people still want to work for this agency and believe in the scope and mission of our work. And so we're very excited about that. Excuse me. So far, what we're doing at the job fairs is we have everybody at the table. We're checking fingerprints there. Civil service is there, qualifying candidates. We've never done anything like this before. We have additional HR staff there with us, loaned to us from the division to supplement our HR staff so that we can interview as many people as possible. We were able to do 79 conditional offers between those 2 fairs. After you make an offer, there's still an awful lot of paperwork that has to happen. We're doing drug screen. We can't do the drug screen on site. We are doing the fingerprints so we can do the criminal history check. We have to check references, and there are a lot of processes that happen after the offer is made. So they're not all here and on board yet, but they're coming, and that gives us great hope. 32 of those were for child welfare. The rest were for the family support side of the house. Because while this committee is really focused on child welfare, we have a staff need in the family support side of the house as well. In our eligibility programs, we need staff there as well. We're also actively recruiting a position that was given to us called resident workers, that were people that we could hire very quickly through kind of an emergency standing contract that we have with emergency preparedness to supplement our staffing levels in Baton Rouge and New Orleans, where things are so critical. The most exciting thing, and I'm stealing a little bit of Dr. Hodnett's thunder here, but the most exciting thing is that we have hired 11 nurses that are helping take the substance-exposed newborns and going out and doing those investigations. Right now, they're paired up with our staff because they still have to kind of learn our process. But you know, one of the things, again, that Senator Cortez mentioned was that we needed to think differently and look at a different kind of staffing and be more open to that, and we are. So we have 10 more nurses that are in various stages of onboarding, starting their work with us. They have had almost 100 cases assigned to them so far. They've done 55 visits. Over the weekend, and I thought this was interesting for you to hear, 31 visits were attempted over the weekend. 9 were assessed. 12 had the wrong address or the phone number, and we couldn't make contact. 10, nobody was at home. So even when we have the right exact kind of person to go and do the work, we can't always get through to the clients because this is something they're not required to do. We're required to go see them. They're not required to see us. It is very encouraging and uplifting that the young parents, these are young mothers, you know, we're coming to see them when their babies are just days old or maybe weeks old. And they love having a nurse come in to see their child. They feel a lot more comfortable about a nurse coming to see them than they do about a social worker from the state. And so that's a really positive thing that we can't wait to expand. We also directed our home development staff in Baton Rouge to go to every foster home, document the conditions, check everything out, and 100% of those have been done. And then one final thing before I be quiet and let other people talk is I want to give you a glimpse of how we're treating this. DCFS has a huge role in disasters. And when a disaster strikes, we go into what we call a critical incident command structure. We take off our normal hats and we put on our disaster-related hats. And people have different responsibilities during a disaster. We have taken that critical incident structure and applied it to child welfare. We have war roomed this just like we do when we're in a disaster. We're down in our emergency operations center with people sitting at the desk so that we have everybody in the room that we need. We have it's a different way of looking at this work. The National Guard is there with us, hand in glove, helping us be strategic and thinking. Members, we have taken very seriously your admonitions and encouragement to get things straight and right. And we are doing everything that we believe that we can. We are open to more suggestions and more ideas because your ideas have been fruitful and helpful. And I am proud of what this team has done. I think we're all exhausted. I think some of us are kind of running on low energy and low fuel. But the outcomes will tell the tale. And our goal, our mission, our desire is to serve the children and families of this state to the very best of our ability, regardless of how many people we have to do that. We have been abundantly clear with you from the beginning that we need more staff. We are augmenting staff in every way we can. Some of these contracts you will see and hear about are staff augmentation for other people to do the work, because if we don't have the staff to do it, the work still has to be done. And so I will pause now and let Dr. Hodnett, although I took most of her thunder, I'm sorry.
Let's take a little pause. Any of the committee members wanted to comment, or you just want to continue to hear the testimony? You want to do that? Okay, we'll continue with the testimony. Thank you.
Okay. Good morning. Rhonda Hodnett, Assistant Secretary, Child Welfare. So as the Secretary said, there are 7 strategies that we've identified as core to stabilizing our system and then beginning the rebuilding process. Many of these have been in the works prior to this emergency, but we've been able to build out on them more, and this emergency has helped us to remove some of the roadblocks and the barriers that were just making it take so long to get some traction. So some of them are new, some of them have been in the works, and we're just continuing to move forward with them. The 3 that I wanted to really bring to your attention are related to the most critical pieces that the Secretary talked about, getting more people on board. We know that our staff are our greatest resource, that is where the service to children and families come, and that is the critical piece of getting people in the door and then supporting them once they're in so they'll stay in the door. We spend a tremendous amount on the effort to get people in and train them and invest in them, and we really need to have things in place all along to support them so they're able to continue this work. So as she said, the hiring fairs have been great. It's a very big funnel, a lot of attrition from those that walk in down to those that we actually get a conditional offer to and make it through the process. But the really exciting thing to me is the time frame there. It used to take, on a good day, it was 100 days to get somebody through that process. And now we're down to about 30 days to get them through that process. So that is incredible. Now, of course, we still have all of the onboarding and the training that's required. We tried condensing the training, and the feedback was not good. They felt like it was just too much information. We needed to spread it out a bit more like we had been doing before. And so we're balancing getting people there and getting people there prepared to do the work. So we are going to make adjustments in our training model and make sure that we are adequately preparing people. We're also supplementing with on-the-job trainers and other people to go out with them so they are as prepared as they can possibly be to do this. Also, as the Secretary said, those other supplemental workers that we're bringing on, they are going through our training as well, so they're prepared to do the same kind of work that we're doing. So the job fairs have been great. The streamlining piece, which is outlined here as part of the strategies, has really been very, very helpful to get that time frame much quicker. The second area is around the growth and complexity. So we all know that during the pandemic, calls went down, investigations obviously went down, but the numbers are going back up. And I'll just give you an example. So it really mirrored the pandemic's impact. So in the investigations, in the last half of 2021, the average number of investigations per month was 1,406. In the first 6 months of 22, it jumped to 1,628 statewide. Since June, it's jumped to 1,940. So the progression of reports and that actually meet the criteria for us to have to investigate continues to go up. And so we know that both the number and the complexity, as you all are seeing in the news every day, the drug situation, the serious drugs, the youth violence, gang violence is just really impacting the cases that we're getting. And so the complexity of it takes a lot of expertise at the table to be able to serve these children and families well. One of the things that we're doing that you'll see in the strategies is this child protection team model. It's part of what was recommended by the Justice Department as a model to it was particularly designed for law enforcement's role, but it also outlined the role of other parties. And so we have been working with, in Baton Rouge to set this up. We're working with Baton Rouge Police Department there at the table, the Sheriff's Office, the District Attorney, the Child Advocacy Center, all of the players that have a common interest in this. And we're going to be co-housed with them at the Family Justice Center so that there is much, much greater opportunity to share real-time information, real-time data, to have access to the same information, whether it's law enforcement or us when we're working cases together, and to truly have joint investigations, not just parallel investigations where we're aware of what each other is doing and what they know about the situation so we can make sure that we're providing the best opportunity for safety for children and families. So that is a very exciting piece. It also includes the incorporation of something that Texas did where they brought in what they call special investigators, and these are either retired or people with law enforcement experience that they have hired as part of their child welfare staff and embedded them in their investigative units so that there is that understanding about, first of all, understanding of all that law enforcement has access to. So they are aware of opportunities to do certain kinds of searches, certain kinds of just access certain things that we may not be aware of. They're also a great liaison with law enforcement, and they're just another presence with our staff, so it helps supplement our staff. They also have a detective sort of mindset that helps us see things that we may have been looking over that they're picking up on. So that's helpful. We've actually had people working with the Texas group and very impressed with it. Just a week ago, I was able to talk to some of the people there that said that it has been one of the greatest things that they've done. It has helped really training across the board, having them in there. And so that multidisciplinary team, having law enforcement, the CAC, domestic violence expertise there, substance abuse expertise, and our next big piece that we're working on now is getting medical and behavioral health people there. So we are working very closely with the managed care organizations. That's another one of the strategies in there that could be a whole session by itself. But we have interviewed all 6 of them. We have selected 3 of them that are very committed to working with us to enhance the services that foster children and the families we serve receive. And so we're going to be working closely to get more medical services available to us 24/7, to both us and foster care parents. The other strategy that
I think you brought up a few questions, so why don't you take a little hold,
Okay.
and we'll start with Senator Mizell. Senator Mizell, you first.
Thank you. Thank you, Mr. Chairman. So much content in what you're sharing with us. And, I mean, there's like, I don't know how many points. I love the nurses. I love the response for the job fair. And you told us to have a conversation.
No, I'd like this to be a working meeting.
I agree.
A working meeting.
So in that vein, we have come every committee and said we want us to be a team. We all wanted the results you're sharing with us right now. I just have to say that with all the agony we've shared, and frankly the tension, the news stories that it's our fault, good things are coming from this conversation that I don't believe would have happened otherwise. And I think it's really important that we allow an unpleasantness to get us to a better place. And I think I'm looking at the detail. I got a lot of detailed questions, like I want to know what the National Guard's doing. But at the heart of it, and when I look at our status, I just left a meeting on rape kits, and I'm like, we need to back up and rethink a lot of what we're doing. If we can step on each other's toes a little bit to get to a better place, then so be it. And I hope, I feel clearly that you all feel we've stepped on your toes. Frankly, the article today, I think we all feel like our toes have been stepped on. Okay.
Why don't you expand on what your thoughts are? 'Cause
I think if you saw the article, the legislature did not fund you sufficiently. Everything you're doing, you've been funded for. Mm-hmm. Everything you're doing, we funded you for. We could not help positions that were not filled. But if we're going to be a team, we're going to lock arms and struggle with the money and getting it done together. And I think that's what we've got to accomplish and leave here with that commitment. So with that in mind, and I just had to share that because I think that's at the heart of so much that holds us back. I don't want to step, Marquita, you and I have worked on a lot of things. But I'm really excited. I'm really excited about the job fairs. I'm excited about the hires. And but to get to the technical, okay, I purged myself of how I felt about that. When you said the hiring the process was cut from 100 days to 30 days, I want to ask you how, but more than that, I want to know, do you feel like you've got a less qualified employee?
I will say the jury is out. We will see, because we have cut the interview process significantly. We were using a model that has been used across the country, developed in University Child Welfare Training Academy in North Carolina, has been vetted and used well. That took about hour and a half or 2 hours to get through writing samples and just understanding the person's ability to think critically, their engagement skills with family. So it was very involved. This is condensing it down to about a 30 to 40-minute interview, still doing a writing sample, trying to put some pieces in place there. So we will see. I hope not, but we are working with the Blanco Center to look at the results that we're getting and figuring out exactly what we learn from it. I will be thrilled if we can get a good candidate in 30-minute interviews. I will be the first one to say, let's keep that up.
And just in the previous conversations we've had and with previous employees or whatever, that to me is an incredible opportunity. I mean, I don't want to micromanage, but that's what we do. For a senior employee to be a mentor to these people who've only had 30 days training, that you're building, you talk about team culture. I saw team culture mentioned several times. That's got to start at higher. And that is just a tremendous opportunity to solidify a team culture.
There's
So-
on-the-job trainers. They're retired people who we brought back as WAEs, and that is the role they're playing.
And one other thing, and I know other people have, when you talk about the situation with the increased numbers, which is really disappointing, I would love at some point in this ongoing conversation for you to tell us opportunities that we're not taking to preempt this. I mean, I know the big picture is we've got kids who have no options. They don't have a high school diploma, the home, whatever. But I would love to know all those little areas that we could insert some reforms, something that would give us a better outcome that would address this direction. Okay.
Great. There are some things in here that are pushed out a little further,
Right.
Into maybe March of next year, so we can get through some of the most critical things. So I would love to talk to you about that.
Okay. Thank you, Mr. Chairman.
Thank you very much. Vice Chair Barrow?
Thank you, Mr. Chairman, and good morning, ladies. Good to see you this morning. I'm glad that I'm here. I'm so regretful that I wasn't here for the last hearing. But I have a lot of questions, and I was going to really save them to the end. But as you were speaking, Brenda, I really wanted to kind of stop you for a moment, because I wanted to find out the 3 MCOs that you guys have chosen, and I'd like to know who they are. Then I'd like to also know about this investigative team. That gives me a little pause in terms of some of the people who y'all mentioned and some of the issues I think that we faced in the past, or some of the resistance that we received in the past in terms of, I'm going to use human trafficking as an issue, and some of the resistance that I think that we faced with law enforcement along this arena. So as you guys are selecting folks, what is the process in terms of evaluation? And how do you go back and look to make sure that it's actually rendering us the expectations that we are looking for? And then there was one other question that I had for you, but I'll start with those two.
Okay. So, Senator Barrow, one of the things, it sort of answers Senator Mizell's question also about the National Guard. So that is a piece that they are leading for us. That they're facilitating the conversation.
They are
The
leading.
Child Protection Team.
Okay.
So the assembling of the Child Protection Team, we are, they meet every week, and they are making sure that this is built together, that there's not one person who is in charge, moving it a certain way, that there is collaboration, coordination, that we are all on the same page about the goal, the mission, the purpose in this. I really think, in particular, because of the human trafficking things that are getting ready to really be implemented in January, that is a critical piece, that we're all together understanding these cases and sharing information about these cases. So I hope that that will really help instead of be any kind of detriment. We've had a lot of cooperation with them, so I'm very
Them
optimistic.
being
Baton Rouge Police Department.
the police department. Okay.
Department is Sheriff's Office.
Okay.
Both of them, their highest officials, met with us, sat down at the table, and committed to working collaboratively with us.
And so we know that this is the pilot, right?
Yes.
So I'm not really speaking to Baton Rouge in particular because I know that they've been very open. But we do know that there's been some hesitancy when you look in other parts of the state, right? So that's one of my concerns. One of the things I didn't hear that I think an individual I think needs to be included as a part of this conversation are judges who, and these could be retired judges who have worked in this arena. I would like to see someone like Charlie Zena from Tulane Institute, where you talked about the psychological impact and some of the psychological barriers or situations that occur, because you need to have someone who really deals, I think, and they can help the National Guard, right? Because the National Guard is familiar with, and I'm not going to just say not only, but for most part, infrastructure, right?
Right, Senator, the role the Guard is playing is they're planners.
Okay.
They are people that have been trained in Lean Six Sigma. They know how to do strategic processing, and so that's what the Guard is
So
doing.
they're the planners.
They're the planner helping us strategize, and they facilitate these conversations so that DCFS isn't leading it, law enforcement isn't leading it, the DA isn't leading
Gotcha.
it. The National Guard
Understand
staff
that.
person is leading it.
But I think we need to have some more people at the table. Some of those folks that I mentioned who work directly with the children, who see them or have seen them, I think needs to be a part of the conversation. So they are the planners, and I get it. And they're good, and they're excellent at doing that. But we want to make sure that we have some of the other folks that need to be at the table. Yeah, managed care organizations.
Yes. So, Aetna, Healthy Blue, and United Healthcare are the three that we've selected that we're going to be working most closely with. We had, as I said, we had meetings with all 6 of them. We then had another meeting with the 3 of them to talk to them about expectations that we have and to try to figure out how do we get better service, how do they help us to develop, I guess, a subpopulation of providers that will specialize in working with our children and families, that will be available and accessible to us at times when we need it. Just a quick example is the ability to take a child who comes into foster care for an evaluation, a medical evaluation, quickly. Workers are having to wait way too long to get that in place. And so having an arrangement, an agreement with a subset of providers who say, I am willing to be accessible and available to you whenever that occurs in this particular area, and having that across the state. So we're talking about mobile crisis for adolescents. So there are several things that we've identified that we think will both be some savings to them, which we hope will further incentivize them to be at the table and thinking very creatively, as well as help the children and families that we need helped.
Aetna, Healthy Blue.
Aetna, Healthy Blue, and United Healthcare.
United Healthcare.
And
Do they have the
Senator-
largest footprint in Baton Rouge?
We did look at that when we selected, so I can send you the information on it, but they all have sufficient footprint. Aetna is new to the table.
Right.
They had not been one of them, but I'll tell you, they really came to the table in a way that said, we want to partner with you, let us know. And we do have judges that are part of that conversation. Judge DePlanche is included on our meetings with them to offer a judge's perspective about the needs that they're seeing as well.
Okay. I know that Louisiana Healthcare Connection has the largest footprint in the state. And I'm not quite sure in terms of the criteria that y'all may have used, but I'm just, maybe that's going to be an offline conversation. And just,
So is that the Healthy Blue Group? I think.
No.
Louisiana
No.
Healthcare Connection. Let me check it.
they have the largest footprint in terms of MCOs in the state. So it's interesting to me that they are not included, but maybe y'all have some kind of rubric that you use to make those determinations. I will have a question later on, Mr. Chairman, for civil service as we are going through the process, but I'll stop right here. Thank you.
What we'll do, Madam Vice Chair, is after the testimony, we'll call upon civil service, or at any time you want them on the table. They are here in attendance.
Thank you.
Thank you very much. Senator McMath?
Thank you, Mr. Chairman. I'm going to go back a little bit to what I think my colleague, Senator Mizell, was alluding to in regards to this article that I woke up to at 5:30 this morning. It was unfortunately the first thing that I read. Louisiana is flush with cash. Why is child welfare still woefully underfunded? Basically, the premise of the article can be summed up by a quote from a Baton Rouge judge. Let me find it. Talking about his prediction of childs either being abused or dying in the care of or supervision of DCFS. Quote, and the legislature is going to be mad. They're going to call hearings. But they're at fault for woefully underfunding DCFS. It goes on to include some stats and information, most of which revolves around 2014, 15, and 16, 7, 8, 9 years ago. Clearly not when this administration was responsible for the cuts that the department underwent, and right at the beginning of their taking office. Again, 6.5, 7 years ago. And then it goes on to talk about how the legislature the past year or two have been flush with cash, and a lot of that money coming from federal coronavirus, COVID aid, and all of the things is the reason why we've been able to send significant amount of dollars, 100 million or so, to quote-unquote pet projects within our district, ignoring the fact that that's one-time dollars and would be woefully irresponsible to fund recurring expenses, but we don't need to worry about that. But the theme was, again, that legislature on us for not funding DCFS properly. And by the way, this is not geared towards you, and I'm gonna finish more on a positive note, so just bear with me. I had staff, in response to this, run through, just do a quick search of the 5 most recent articles regarding DCFS, because I was a little confused as to why in this article there's not a direct quote from Secretary Walters or anyone from DCFS. And sitting here, I've realized that this has nothing to do with you. Did anybody reach out to your office in regard to a quote for this article?
We were interviewed and provided all sorts of financial data, and yes, I did interview with the report.
Okay, well, they didn't include your quote in here. So, but just to go through, kid raped by foster parent, deputies say is shocking arrest, DCFS at the center of a new controversy. I believe Secretary Walters provides a quote in this, or a statement. The investigators, DCFS previously involved in the mother charged with murder and child's hot car death. There is a statement provided from DCFS. And this one, lawyers plan to file a lawsuit after toddler's deadly overdose will focus on DCFS. I did not actually see a quote on this one or a statement from DCFS. Again, much like the one that we read today, the investigators, DCFS confirms active case involving death of Navia Allen. Obviously, you've confirmed that, so you provided essentially a statement to the news media, DCFS employee describes morale issues challenging of working for the agency, something that we all heard last time we met, and the countless emails that my office has received in regards to child welfare workers and what they see as the real problem is not necessarily pay, but the environment with which they work in. We all heard that last time. And there is a quote from you, Secretary Walters, in this. If I can, I would like to also had staff do a little bit of research, and I appreciate them doing it at such short notice. But I had them pull up in order to maybe make this more of a complete story, a quote from Secretary Walters from the DCFS presentation to the Finance Committee on the budget from March 17th of 2022. So this is a direct quote from Secretary Walters. Our budget, quote, "Our budget is really very adequately funded. We are stabilized. We are making market rate adjustments on salaries." And she says, "Where we hurt is human beings to do the work." Again, consistent with the testimony that obviously we've gotten today and the actions that you've taken to address that. And the testimony that we received the last few days. If you're interested, the DCFS presentation by Finance starts around minute 33. But Secretary Walters' statements are an hour and 13 minutes if you want to go back and look at that. Listen, this doesn't help. And I know that this is not for you guys. We're all here, as my colleague Senator Mizell said, to try to address the issues that that DCFS and the children that are in your care, have unfortunately experienced over the last, several years. I want to, one, help complete a story that was probably written incompletely, and really it was a pretty cheap shot at the legislature. But more importantly, much more importantly, is to say thank you for taking our information and our put seriously and doing the things that you've talked about today. Admittedly, being candid and honest, it is frustrating that it has taken, some years to take some of the actions that you're taking. I mean, Secretary Marquita, you said it yourself. You're doing things that you've never done before, and you're doing it because you have to do it, and you're doing it at the urging, I think, of us, and that's our responsibility as legislators to have some oversight and to push where and when we see fit, mostly motivated by the input that we receive from our constituents. But I want to say thank you for doing, taking the action that you're taking right now to try and address the issues, allowing me to vent this morning. Again, not at you, but and look, I'm a freshman senator, and so some of these folks that have been around for a little bit longer are probably used to media reports that are either incomplete or distorted or just not helpful to what we are up here trying to do and what you guys are wanting to do and taking the action that you're taking. So thank you for that. Thank you, Mr. Chairman, for allowing me to.
So what you're saying is that you're not going to nominate that article for a Pulitzer Prize? Okay.
No comment.
Senator McMathis, somebody who has recently been in the press a lot, I understand your frustration. And members, I want to be clear. I hope and believe that I have been transparent with you for 7 years. I have come to the table in every committee hearing telling you we needed human beings, and I unapologetically, because of the cuts that the agency took during the previous administration. That's just true. We're a human service organization. You can't do this work without humans. Our budget has grown year over year. I think that data is, I haven't read the whole article. I will admit that. But we are very clear that our budget has grown. Our budget has grown in technology, huge investments in technology in this agency. It has grown in services that previously the department had to absorb. Rent. Cost of living has gone up. Everything is more expensive. In previous years, those kind of things, when the costs go up, the department is just told, you got to absorb that. We were given the money to pay for that. The raises that we have been able to give, working with civil service, getting the approval to give raises, because, I can't just decide to raise a salary. Trust me, had I had that authority, that would have been done 7 years ago. But that's not how this government system works, which, by the way, coming from outside of state government, is constantly a sore spot for me. I'm used to private industry where you can make decisions differently. All of those things have been funded, and we appreciate that, and we acknowledge that, and we've always appreciated and acknowledged that. I am grateful, as much as it has often been painful and felt personal. I am grateful for this committee and for the oversight. I do want it to be a partnership. I shared with a couple of you, I believe, that when I was working for the state of Utah, they had an oversight committee that came out of the result of a bad case. It started very acrimoniously, wasn't really a pleasant thing. It turned into a wonderful partnership where the committee met with the department and really often met outside of the public arena so they could really dig into data, into cases, and to learn the agency truly well. And then they are the spokespeople for the rest of their counterparts who don't have the luxury of digging into each agency. There are 20 of me for y'all. You've got to learn an awful lot to try to make good decisions. And I do appreciate this committee's oversight and this opportunity. We are doing a lot because you have said you need to do more. I want to be clear, there's a lot of it we were doing before. And I also want to be clear that if you look at the transition team report that shows what we walked in the door to, and you look at our responses that we highlighted in blue so they'd be easy for you to see, you will see what we've been doing for 7 years. Because, members, we've not been idle waiting for y'all to get mad at us and tell us to get to work. We've done some significant, extraordinary things in this department that we're very proud of, that we've received national recognition for. And so I mean it from the bottom of my heart. I want this to be conversation. I want this to be work together, because you're going to see it differently than we see it, because we're in it, in the weeds every single day. And it is very helpful to have fresh eyes, and eyes that aren't burdened by the depth of horror that happens in humanity to children in this state that we are dealing with every single day, talking about waking up at 5:45 in the morning. Those are the things that wake us up in the middle of the night. We need you. We want your help and your attention. And if I have ever given the impression that that wasn't true, I apologize, because that is my belief. We are better together. I'll stop there.
Thank you very much. And I'm getting ready to call on Senator Pope. What I'd like to do as you complete your presentation is just to be thinking about it. There's 7 strategies that are in our book, and you have the 7 strategies basically outlined with timelines, maybe levels that you've completed, levels you're working on, dates you hope to accomplish. Maybe we'll do a quick overview of that. And what I'd like to do from the committee standpoint and your department standpoint is this template will be the document as we meet between now and the end of the term of this committee. Because I think if there's a critical point that you say in the date of achievement is January of next year and we're nowhere close, that's the conversation. You know, that's the conversation we all need to have. Why is that not happen? What's the obstacles? Where do we go from here? So what I think the goal of this committee is, it's good to hear the goals, and we want to hear it, but I think it's going to really break down to, are we achieving those goals? And we're achieving the timelines? If not, what's the obstacle? On that note, Senator Pope, it's all yours.
Thank you, Mr. Chairman. And y'all just have to bear with me. I wish I was as sophisticated as Senator Mizell, as articulate as Senator McMath, but all of you know that I don't have much to say, but today I got something to say.
Well, it's all yours.
And
there's not a
I'm
shot
not sure
clock.
how it's going to come out, but I'm going to say it. And I apologize in advance. First off, let me just say I appreciate y'all's work more than anybody knows. I understand what you're going through, having been on a distant part of that, but I also understand that we've got frustrations, and I haven't said a whole lot up here, but I got frustrated this morning, and I'm not going to pile on what's been said about what the article was in today's paper, but that probably upset me as much as anything I've seen in a while, and that is the fact that we're going to right now have, 300 vacancies, give or take?
Unfortunately, it's a little more than that, Senator.
Yes, I said give or take. I'm just picking a small number. So we got those vacancies. Yet I also read in that article where we're going to ask in the next budget cycle for 250 more spots. Now, if money is going to solve this problem, I think that we can find the money. But money's not going to solve that problem. I could give you all the money you wanted, and you still got 600 spots that you're looking for. Is that correct?
We are working every day to fill that. I know.
Don't,
Yes,
don't,
sir.
don't.
Yes,
I don't want to
sir.
interrupt you.
Yes,
I know
sir.
you're working. I'm convinced of that. I'm convinced of what you're doing. I appreciate what you've done up to this point in time. What my point is, the fact is that we could give you all the money that you wanted. You still couldn't fill those spots. You're trying. You talked about a while ago, you did, about the fact that we're going out, we're doing job fairs, we're cutting it down to 30-minute interviews or whatever. We don't know the outcome of what kind of employee that has. I've got some issues with some of those people, too. I'm going to be honest with you, about the consistency of what goes on in some of these places where we go out and we look. And it happened in my district, so I know firsthand what I'm talking about. I'm going to get into that. That's another story. But we've got to have consistency on that with the employees that we've got now. I digress. I'm sorry, but that's where we're going. You understand? I just have that, so I don't want to jump on that. I have come to the conclusion on the way over here this morning, though, that, one of the things we may have, and that I don't see anything in here that hadn't been brought up, and I'm going to bring it up today. And I don't know if I'm going to pursue it or want to pursue it or have further discussion about it. But I'm not sure that this agency is not too big. I'm not sure that we don't need to break it up into smaller silos so that we can have a better understanding of what's going on so that everybody can get a better feel. Not that you haven't done a great job. I applaud your job. That's not what I'm doing. I'm not looking to try to replace people or do anything else. But you sit there multiple times, and I've heard you say that this job is overwhelming. It is. I understand that. Maybe it's time that we look to try to break it up in smaller groups and have a better feel of what's going on, and we can have, instead of going 15 steps up the ladder, we can just go 5 steps up the ladder to get somebody that's in charge. You follow my drift? Probably not, but that's where I feel, having been there on that. I just feel like that there's more that we can do. I applaud what you're doing, but I think that there's more that we can do. Our job is to have an oversight committee. That's what we're trying to do, trying to make things better. One of the ways I think we might be able to make it better, in my opinion, and I'm going to look at it strongly, I promise you, I'll tell you up front, is to break this thing up and where we can't break this department up into smaller issues. I think it's too big. That's all I got to say at this point in time.
Very good. And look, I encourage the members, this is a working meeting. This is not a piece of legislation we have in a debate. So this is a good working meeting. On that note, I'll turn it over to Senator Luno.
Thank you, Mr. Chairman. Recently, somebody made a comment about me that I overheard, and they said I was a bull in a china cabinet. And I really didn't criticize them for it because it's probably pretty accurate. So I'm just gonna put it out there like it is. During the Jindal administration, in his last years in office, they drastically cut this department. It was untenable. You couldn't do your job with the amount of money you've had. Since that time, when I came in office, when you came in office, Madam Secretary, when the administration here, and many of us in here, we worked diligently and advocated for the department and got the budget back up to a reasonable level. Have we give you every dollar that you've requested? No. I don't know of any department that gets every dollar they requested. But when we have an article that comes in that's horrible timing, when we're all working so hard together to try to right this ship, to say these things and to quote a person with apparent authority of what an understanding of what goes on, to make a flippant comment that at best is inaccurate and at worst is intentionally inaccurate, to say that we're not funding the department in an adequate amount, it defeats everything we're trying to do. And it's poor reporting. I mean, that's all you can say. They don't lay it out and say what happened and how this really worked. Let's just say it. It's the truth. Let's say what's up there and don't try to sugarcoat it. It was horrible. We're trying to fix it. You're trying to fix it. Everybody's working really hard. I'll take part of the responsibility because since I became chairman of labor, unemployment is the lowest it's ever been in Louisiana. That's my fault. I did a great job. I'm sorry for that, but we'll try to fix that. And I say that tongue-in-cheek, but the fact of the matter is this is not just an issue with your department. This is what's happening all across the state and many places in the nation. When we went through COVID, it changed everything in our lives. It changed everything in the market. It changed everything in how people work. And we can't stop what you're doing because of all that. We have to continue to go. I, too, am going to join the bandwagon, applaud you guys and what you've done. You worked really hard. There were some serious problems. We all acknowledge that. Everybody is working together. Why don't we, our friends in the media, come in and say, hey, there's some positive news here. You know, I tell people all the time over in Texas when they say, you know, we have potholes here, but they're the biggest and best potholes in the state. Well, we don't do that. We accentuate the negative every single time, and I'm sick of it. Let's talk about the positives a little bit, and let's move on, and let's try to correct the negatives. So I'm going to get off my soapbox now, but thank you. And Madam Secretary, I just wanted to point out, this article wasn't you. You didn't say these things, but it is very frustrating. I join my colleague, Senator McMath. It's incredibly frustrating when we know what we've done, and it's not reflected at all in what's reported, and that's unfortunate. I'll stop now, Mr. Chairman. Thank you.
Of course, I see WFB TV. It looks like you're doing good. Keep it up. All yours, Senator Barrow.
Thank you, Mr. Chairman, for giving me another bite at the apple. And I feel that I would be remiss if I didn't make some comments behind my colleagues' comments as it relates to the budgetary issues and what we've been through. So I was one of the members who was here, along with you, Mr. Chairman, and with many of you guys that was here during that time, and suffered great trepidation. First argue was at the well, trying to defend, trying to make sure that these cuts did not happen under the last administration, under the Jindal administration. What I just want to mention here as we go forward, because one of the things, and one of the questions that I do have that I'm going to ask later, because as I looked at the your chart going forward, and something I saw about something being maybe temporarily ended in February, is how do we sustain this? So what I want to say to my colleagues who may be coming back under the new administration, because this governor has done everything he could possibly do to try to make sure we bring the department back, try to shore it up. All of us working here have been supportive of those measures. But when the new administration comes in, is what I want to talk about going forward, because I don't want to see us go back to those days. And really, we have not really recovered. We are in recovery. We have not recovered from those days. I don't want to see us go back when the new administration comes in, and I'm putting this on the record going forward, because at the end of the day, this is the agency that has the on hand, have to be on hand with the people that they come in contact with. I often say, and have always said, that you guys are the heart of state government, because what you do impacts the whole being. Every department is important, but what you guys do impacts every facet of every person. And so as we go forward, members, as we are working really hard to ensure that we are bringing this department back, that we don't take steps backwards in the next administration. I've heard a pastor say once before that sometimes your adversary serves as a great tool to move you forward. And so this situation has been adversarial at times, but it has propelled us to move in a better direction. And so I believe that we are moving in the right direction. I applaud you and your team for coming along, doing what you can, really taking those aggressive steps. You know, you say y'all in the war room every day, that you're really looking at what's going well, what's not going well. That's taking a lot. But it was the adversarial piece, right, that may have pushed you to that point. What I don't want to see happen is us regress. When this administration is over with, and when the new administration comes in, and everybody wants to talk about cuts, let's remember that we don't cut this department. That's what I need to say.
Very well said. Thank you. Senator Hitchkins?
Thank you, Mr. Chairman. And Mr. Chairman, I'm not going to go on the record and say the local media blew it this morning, but whatever. Doc, we got through the first two strategy points. The third one's about high-risk infants and toddlers. And our decision tree blew a high-risk situation earlier this year. And so I want to know what the detail is. What did we change in here? What did we change to make sure that we don't do that again, that it's not because someone took a vacation or anything else after 3 notices that we get this thing right and we get it flagged right? I mean, this one's very important to me, so could you explain it to me?
Sure. There are several things that we've done already. One is we made some policy changes around reports being accepted from medical providers. So if a child 3 and under is reported by a medical provider that there is abuse and neglect suspected by a parent or caretaker, that report is accepted unless it goes through multiple levels where a manager overrides it. And the reason that that is important is because right after this hearing, we stopped it at it just accepted. If a medical provider makes a report of a child 3 and under, we accept it. And we were bombarded with reports that really did not meet the criteria of abuse and neglect. They were reporting things that were, one example I asked for was concerned because a child had COVID and the child may not be taking the medication, or the parent didn't want to get them the vaccination. So things like that really did not, it took time away from us being able to respond to the more serious cases that we must respond to. So there had to be some assessment of the reports and ability to make a decision on that, have some discretion on them. But I will tell you, they're very, very tight on that. So we have taken many more cases that involve young children. Another area that we're working on is the nurses. So making sure that we understand the kinds of things we're looking for in young children and making sure that we're attuned to that. It's not just looking at the child and saying, I think this child looks well. It's contacting the pediatrician too, verifying the care of the child, really understanding what they're looking for in developmental stages of a child. So that's another piece that we're incorporating into there. We have put, especially in the Baton Rouge office, because they are so understaffed still, we have so many temporary people in there. We have put several layers of supervision staffing around cases. So it's a safety wraparound model, basically, where people are doing a pre-investigative plan. So when the report comes in, there's a supervisor who is brought in to work particularly in that office that is making sure that the plan of the worker who's going out is comprehensive and thorough, and everything is understood of what they need to do. There's a plan when they're back, looking at that safety plan, which has always been a part of our work, but the closer follow-up on that. So multiple things done there. trying to see some of the other things. We are, as part of our Families First initiative, there is a program called Child First, which is specifically designed for young children and their families. It's an intensive in-home service program. We are implementing Child First in several areas of the state, and one will be in Baton Rouge. That we're hoping will start in January. So multiple things that really focus on the very young children. That is one of the things that has come out of the Commission to End Child Abuse and Neglect Fatalities. One of their recommendations is a much closer look at children 3 and under. Obviously, they're the most vulnerable, and as Senator Mizell pointed out earlier, there may be opportunities to intervene before we receive a report that alleges abuse and neglect. So how can we identify some of these families up front that really could benefit from some services and not get to that point?
No, thank you. I mean, that was obviously a shortfall we had, and it sounds like you've got a lot of things in place to cover it, and so I appreciate that work. That's all I have, Mr. Chairman.
Thank you very much, Senator. I guess on that note, before we turn it over to Senator Mizell, you know, from you can't. There's certain things that just happen, but from a high-profile situation, we've seen some high-profile cases that we won't talk about those specific cases. But from the guardrails you've put in place and from what you talked about, do you feel more assured that we won't be seeing these cases in anytime soon? I know there's shortages, but there are internal controls, and we have to live with what we have. Do you think those type of situations have been mitigated to prevent that again?
I think that we have multiple strategies in place to prevent the likelihood of this happening. We can never.
You can never do it,
guarantee
but you feel you've
feel like we
mitigated the opportunity that could happen again from the problems you had?
I do. And I would just say to keep in mind, first of all, the much of the information that is known publicly about the cases is what has been reported in the media. And just like this report, perhaps everything is not
Sure.
known or being reported. So there's always more information that might round out or provide more context to the situation that could have it look very different. So I will say that first. And many of the, at the bottom of the line, many of the families that we touch early on are at very high risk for.
But I guess what
for
I'm saying
outcomes.
is,
we have things in place as, yes, we've tightened everything we can possibly tighten to the greatest extent possible. I am just so cautious of saying, this will never happen
No,
again.
I understand. I guess what I'm saying is lessons learned, and
Yes.
you mitigating it.
Yes.
What would you say is that one most mitigating factor that you've implemented that at least we hope and pray this never happens again?
So I would say probably the tightening up of our intake, so making sure that we have a supervisory level oversight over every decision that's made at intake. A real emphasis on the fact that when a report is not accepted, when it's called in and our intake staff determine that it does not meet the criteria, it is sent to the local office, regardless of it accepted or not accepted. It always goes to the local office. There's a second level review. And I believe that the emphasis that we've put on that second level review and saying, here's some more eyes on this. Is there something we might have missed? Should we have taken this? Do I need to send it back? And a process that's reviewing that. A QA process that is more intensive in those cases. And then just the constant awareness of our staff. I do believe our policies were solid prior to this. Our practices, we had them reviewed by multiple entities. It's the ability to carry it out and have enough oversight with supervisors and people who have good clinical decision-making skills to be able to do it, who can read between the lines. The information that someone gives you can be very, they will tell you what they want you to hear. And so you have to be able to know how to look behind that, reconcile conflicting information, determine when there's a direct contradiction, how do you weigh that? And where do you give more more credence to information. So I do believe we have done, if there was anything else we could do, I would have done it.
Understood. Thank you for the answer. Madam Pro Tem?
Thank you, Mr. Chairman. Thank y'all. And this is not where I was, this didn't make me press my button, but when you're saying that, I was in an early childhood meeting yesterday, and same need. Early childhood can't get workers, hospitals can't get nurses and doctors, corrections, I mean, you can, in every direction. But in a very creative way, I don't know if anybody's here from the workforce, but the workforce has kind of created a situation where with the community colleges and high schools are going to kind of create a opportunity for dual enrollment and kind of a ladder to so you all may already be doing that, but I think that's something we really need to take advantage of. I want to go back to what you said with Child First. Child First, is that a contract? Are they?
Contract,
So it's
yes.
temporary. And I don't want to put words in your mouth, but I'm going to tell you my impression. It's a nurse-family partnership, right? Is that a nurse-family partnership?
It's a clinician, a mental health clinician, and a coordinator, a resource coordinator. So it's a team of two that works intensively in-home with a family with a young child, primarily those where there's substance abuse.
And I don't want to get in your head, but my impression is that you all brought that in as a new contract to fill kind of a fill gap. Okay? So when that, in this dream world we're building, when you have employees, will they, because right now, Child First comes at the point of a call.
Child
What
First-
what causes, and this is where I'm going, when they finish what they're doing with you now, are they going to be able to take a preemptive role for a parent before the call is made to DCFS?
Well, of
Because
course-
that, I mean, this is where we've got to go.
Right. So that is what Families First Prevention Services Act of 2018, that is the whole emphasis of that act, is getting upstream. How can we put things in place before it results in a child being abused and neglected? So that is the emphasis. The first step that the feds made is upstream in the child welfare system. So they're still coming to our attention. They're still going through an investigation, but we're
How do
intervening.
they come to your attention?
A report. So
From
we still are receiving a
somebody,
report. of abuse and neglect.
something, there
Yes.
has to have been an incident or the neglect has already had to happen. But, okay.
For Child First. Now, we'll
Right.
say, if you will see one of the initiatives here, the My Community Cares initiative, are you familiar with that? So we have a resource center, a family resource center in every region of the state. And as part of our federal plan that we did after our reviews that the feds do, we instituted in partnership with the Court Improvement Program and others, a program called My Community Cares in 5 parishes. And it's a real grassroots effort to provide services to children and families before we end up having to intervene through an investigation or further down in our system. It has been very, very successful, and so we have just expanded it in contracts that are starting in October. That was in the works. The contracts were going in October, and so it is expanded to be in one parish of every region that has the highest rate of reports to us. And so we're looking upstream to try and see how can we have a presence in those communities where we're actually partnering with an entity that is a trusted, well-known and respected among the community for being able to provide resources, guidance, support. And so the goal is that people, kind of that no wrong door, right? People can walk into there. We have a navigator there who, if they don't even know what they're asking for, but they're in trouble, they know that they're, they don't have enough money to pay their rent. Their kids are they're afraid they're using drugs. Whatever problems, they're in a domestic violence relationship. They can go there and say, I'm in some trouble. I have some problems. I need help. I don't even know what resources to ask for, but things are not going well in my home right now. My children are at risk of something bad happening. That person helps them walk through a situation, does an assessment with them, and helps them understand what resources might be available to them. That's all before they come to our attention.
And what, and I know I don't want to get too deep into it.
I'll be
but
glad
I'd love
to
to know
spend
what
time with you
triggers
about
them
that.
to be aware that that resource is there.
They're doing a lot of public awareness in the communities.
Okay, because I
let
find,
families
especially
know.
if it's the only location in a rural parish, if it's more than 15 miles away, they're not going to have transportation to get to it.
Yeah.
And that's another whole, I mean, that's another issue. But really quick, on the critical incident reviews, this Casey, the article, are we measuring, like, I think what they were looking at were the results, the recommendations, the impact. Are we getting measures, all the programs you're talking about, the community, when we start with Child First, I think it's really important that we know, we've got to be aware of what's working, what's not, what gives us the best return on our investment in it, and put our money toward expanding that instead of just throwing everything against the wall, which sometimes, frankly, when you put all these different guidances in here, I'm not sure if we're just trying to find something to change outcomes, which is that we do that. But I'm hoping that by measuring the results, we're able to kind of like fine-tune what we're able to do and what we can invest in and have some confidence in. So are you all measuring?
We are. It is part of a requirement under Families First that there is an evaluation component, and again, we're working with Blanco Center on that. So yes, we are measuring. Child First is a parent organization. They are connected to Nurse Family Partnership, and they have a certain set of metrics that they review regularly with us, as does Youth Villages and the Intercept program. That's the other part of Families First that we're doing. All of them have an evaluation component to it.
And if I might be so bold, if we could be on that mailing list, if we're going to continue to be a team, and if we're going to continue, as Senator Barrow's looking to the next term already, if we're going to continue this, give us the successes, but give us the reality. We don't need a pretty picture. We're used to dealing with unpleasant things, but we got to know the reality. And I think that's going to help us get to where we all want to go. So anyway, thank you, Mr. Chairman.
Senator Mizell, if I may, I think my deputy secretary is just going to have some kind of trauma over here. She doesn't get to answer some of this.
I'm done.
There are several points that I know that Terry would love to make about the Unite Us 211, how we're working with the broad picture of No Wrong Door, and I'll stop there, Terry.
Thank you. I love that Renda brought it up in that perspective and talking about No Wrong Door. In everything that we're doing, the focus is, right, quality care to children and families, right? And so when we're talking about the employees, we're talking about getting people on, and we're talking about services, and I appreciate you bringing it up that way. The other side of the house that we currently have right now, Senator Pope, right, is also economic stability, right? And I've never seen two assistant secretaries work so hard together to make sure that when the other side of our house, assistant secretary over family support, is working to make sure we can stabilize families, find people the right types of jobs that will give them a living wage, support them along their journey, their pathway, right? Give them education and training opportunities, which we are increasing under the secretary and with the assistant secretary. That is really our prevention services, right? Because the largest amount of people coming into the care under Renda services are families that are not stable, right? They're not economically stable, and then crimes of passion are despair and other things happen, right? And so it is important, Senator Mizell, that what you brought up. If there's just one center in the center of one parish, of one region, we're not going to win. But we've been partnering with the Louisiana Association of United Ways, that basically is the umbrella organization for the 211s, right? And just as a reminder, if anybody has forgotten, if you pick up the phone at any time and call 211, you're going to actually get a person on the other end of the phone, 24/7, 365. They're going to talk to you about what concerns you have, what kind of resources do you need, do an assessment, and actually give you resources. We've had an increasingly good relationship with 211. And this year, in January, that was shored up in a very healthy way. We have a cooperative endeavor agreement with the Louisiana Association of United Ways for the use of 211, and every person in DCFS has a license to actually search the database itself, not even having to call 211, but we also can tell our clients, call 211. If you can't reach us, call 211. They can give you resources, and now we're rolling out, stepping out, how to put that into our everyday work with clients, finding resources for them. But the other part of that, in addition to getting the word out far and wide to all Louisianians to remember that at any time you can call 211, is that what we requested of 211 was to also have what we call a closed loop service delivery or referral process. And that works like when you go to the doctor and he tells me that I got to go to physical therapy. Before I can call them, they call me because I probably forgot, right? Doing all the work, right? Anyway, I forgot. So they call me, and then I get an appointment. So that's a closed loop referral, right? And so that is a game changer for clients. That means, Senator Mizell, if this family is already identified and working with one organization, they can send a referral to other resources, and then each of those resources can actually see what's happening with this family, and we now have data points that those of us, we can share together to actually show that the journey of this family, of this client.
So are you using that now, or is that?
We have started
So you're
using it.
using that with the 211?
We are using it. So 211 brought that service delivery module to the table for us. And so in the department, we have begun to roll it out. And so the one part of our agency that is 100% using it right now is our STEP program. That's the TANF work program that has a very intense case management part, wraparound services to be able to help somebody on a pathway with employment and training. But it's also about to roll out in December for all of the child support enforcement, and soon after that, the SNAP, and then soon after that, different elements. And so someone mentioned earlier about diversion, like how do we divert somebody from ever making the call that Renda has to take and then determine. So we believe this is diversion, like if we can get, and this, what's important about the Unite Us, and that's the closed loop referral system, that is coming from the ground. We're joining a table already set by many people in the community so that a client, a family, they don't really care who they're getting the services from, right? Whether it's a state agency, a federal program, or a nonprofit. So what's important is that the state should not be looking down on organizations like, I'll help you join us, like, let's all sit together at the same table and help this family. So a family would have to say, the person that they're talking to would have to give their permission, yes, please work together to help me, and then we'll be able to do that. And one of the most important things about that is that we will be able to finally use data to show where we have unmet needs.
Right.
Right, and that's important because right now we do it anecdotally.
Right.
But when we're able to have data around someone's entire journey, you also get to figure out what happened well that this person had
And
the
expand on
outcomes
that.
that they wanted.
Right, right.
And then where are we missing critical services? Then we can also hold hands together to try to figure out how to resource that, how to bring either state resources to it, federal resources, get grants, et cetera. So this is super important to us. And so the partnership with 211 has grown over time. The one thing that we saw coming out of the floods of 2016, and the Secretary allowed us to bounce back from this, is we hosted in 5 different parishes these children and youth boards for recovery. And every parish we went into said, we need to know where the resources are. And then it's just like we forgot that 211 existed. Under the Blanco administration, the state actually gave 211 $750,000 every year so that the 211 system could actually work. And work well so that people would know where to call. We lost that over time, but I'm so excited about the fact that we not only regained it, 211, and providing resources for it, but now we have this closed loop opportunity which will allow us database. We can understand equity, we can understand where there are unmet needs, et cetera. So this is an exciting rollout for us. I think that it's going to be able to bridge the gap between how do we let one agency know about a family who needs services and where do we come in. This is a true no wrong door.
But is the 211 available only to services under your umbrella?
No, ma'am.
So if somebody needs a high school diploma, they're going to be able to go. So it's a far-reaching
Yes, ma'am.
opportunity.
Yes, ma'am. All services
that's-
for families and individuals. And here's the thing. There are sometimes a service that pops up in your area that 211 doesn't yet know about, right? Because they hold people, they hire them for the sole purpose of looking for resources and updating resources. So our commitment, and we can have this commitment as a state, is that when we find something, we want to make sure that 211 has the right information. So it goes both ways. So we update it with them when we found something that they don't yet have, and vice versa. But to be able to have what we thought, you might remember back in the day, Senator Barrow, Senator Mills, neighborhood place is what we started calling No Wrong Door. We had to have everybody co-located. It's just not possible, really, when we only have offices in half, not even half, of the parishes, right? And so this, though, allows that to happen using technology and using the web. And by the way, it is free for nonprofits to use. And so the Unite Us platform is showing amazing promise. As a matter of fact, the Secretary sent 3 people from DCFS down to Florida, right, to make sure that they can help with the storm services, and we see them doing some of these same things, as well as North Carolina and some other states. But this work, we're finding, is also invigorating the staff. They want to be able to help people more than just saying, yes, you qualify or not, right? And so one of the things, and some of the qualitative feedback we've gotten back from staff, is that I want to do more than just the minimum. I want to actually help this person that's in front of me more meaningfully.
Because you know what? You have an opportunity when they call that number to do that thing that we hear about where you're teaching the man to fish instead of giving him the fish.
Exactly.
And I think this is a missed opportunity we do in a lot of different directions. But my concern, my folks don't know about 211.
Yes.
How are you going to make them know about it?
Yes. And
So you tell me, what are y'all doing about that?
Absolutely. I want to tell you about that. So first of all, the first thing that we had to do, and this is, the first thing we had to do was to make sure that all of my staff knew what 211. As a matter of fact, we closed up at 3 o'clock today a survey from staff to shore up, to ask them the question, what do you do when you need to give resources out? And one of the answers on there is, I don't know what 211 is.
Right.
And we've been trying to close that gap using multiple things. And so what I will offer to you is that I believe that the last time I peeked in on the survey, we had 0 people taking the survey that said, I don't know what 211 is. So now I present to you, Madam Secretary, 3,200 persons in DCFS that now become advocates. But we also did in that CEA decide that we purchased the ability to resource 211 enough for us to get the word out. And so we're here talking about it today, and we're asking that you all know and become ambassadors as well. So Sarah Berthelot, who works on behalf of the Louisiana Association of United Ways for 211, is happy, I'll speak on her behalf, to come and anywheres to be able to get the word out about telling people to call 211. In addition, the other thing that we did with that is we knew that there were going to be some organizations using the Unite Us platform, and there would be some organizations that 211 knows about that are not using the Unite Us platform. So in that CEA, we have 9 individuals, 1 in each region, whose sole job is to take a referral. If Senator Barrow needs to send a referral to somebody, send someone to a referral that's not on the Unite Us platform, that 211 care coordinator will pick up that referral, handle that referral with the organization that's not using the platform, put the notes in the system, and make sure that it happens. And so we are rolling it out. The governor is interested and has recently spoke to the secretary about it, and so we're excited about where we can go with this. But this is another one of the things that allows us with the culture and climate work that we're doing at the department is really to awaken people to do the work that they really want to do, right? No one comes to the department just for a job. You would get turned, or you would be turned away at orientation if you didn't want to really help people. So awakening that and allowing people to really have more tools to help people has been another one of the strategies. In addition to continuing to open up various avenues for people to be heard, and also, so this is about employee engagement, but it's also about constituent engagement, the people that we're helping to be able to get feedback from them. So we're building a plan that we will be able to share with you more as we go forward. I know we had a lot on the calendar for today, and we've got some other things to put in place. And one of the things I think that the Secretary expects that as we continue to fill your binder, we'll have more about this information, and I'm be happy to talk more about it.
Why don't we do this? Senator Mizell, you had any more questions? Why don't we do this? Because we're covering a lot of subject matter, and we don't want to cut anything short, but why not, if the committee's agreeable to this, why don't we take the timeline document that we have, and what I'd like to do with the format here is kind of a lightning round of, because we have the 7 categories. So when we take the 7 categories, kind of go through, we can see the timelines. If any committee member has anything on those bullet points, we could start with the first thing, which is recruit and retain staff and foster caregivers. So we could look at it. We see where your timelines are. We see where your levels of communication are. And on each one of those, we can have kind of a lightning round. If there's no questions, we move on to the next one, just a brief comment, and we'll go from there. So I guess I'll get it started. It seems like one of the things we did talk about a lot is the job fairs, the outreach, going into communities, let them know what we're doing. I see you have timelines that are going to go until October of next year. It seems like you've gone to a couple of regions, and what I can remember from the testimony is that Baton Rouge was the main area that you wanted to focus on. So why don't we just briefly, what did we accomplish, what's on the drawing board, and what kind of were the results, or maybe what are the shortcomings, and we'll take each one of those categories. If there's no questions, we move on to the next thing. If there's questions, we open it up. So whoever wants to take it, why don't y'all give us just, and if it's okay with everybody, if I see the communications going, we'll go on to the next topic. Is that okay with everybody? All right. So why don't we talk about the first thing, the job fair. You gave us the highlights to it. Why don't you tell us the success and maybe the challenges?
Well, as we've touched on already in both the Baton Rouge and Lafayette, and we have New Orleans tomorrow, a lot of people come in. As Dr. Hodnett said, it's a wide funnel. We had 150 come in Baton Rouge, 180 come in Lafayette. That boiled down to the 79 conditional offers, and that's for employment across the agency, not just in child welfare. 32 of those were for child welfare. Now, we still, for those conditional offers, we still have to do the criminal history check, the background check, the reference checks. So there's still more work to be done behind the job fair before those people are onboarded and going.
And Madam Secretary, not to cut you short, but we'll just have the report. Has it been beneficial to maybe reach out to legislators in those areas to say, hey, we could partner up? You know people in the Baton Rouge area. Can you reach out to maybe some of the organizations? Have y'all done that?
We did send them, yes, sir, to, you might remember getting yours for last week,
Yeah.
and Senator Carter has his for tomorrow,
Yeah.
and we did that
Very
in
good.
Baton Rouge, yes. So, yes, we are sending them out to everybody. Senator Boudreaux actually, had a press conference the day before the Lafayette job fair and talked about it and highlighted it, and we got a lot of good press on it from that.
was.
So those, as you see, are planned for every region, and we're doing them. The fear or anxiety is it's a lot of work to get these done. It takes a lot of pre-work and it takes a lot of post-work. So if there's a hesitancy in it for us is, can we keep up the pace and make sure we're doing all the back-end work after it before there's another
The
one the
intake
next
after,
week.
so, yeah.
So, but we are committed to doing them in every region of the state because our need is in every region of the state. We're talking a lot about Baton Rouge here, because in Baton Rouge being the pilot, because as I've used the expression, they're the one on fire. Every region of the state needs more staff, and so that's why we've got these literally in every region of the state.
Very good. Senator McMath, you had on that topic?
Yeah, just real quick, Madam Secretary. So I'm actually going to be on the DOTD Roadshow on October 26th. I see you're going to be in Slidell. I've already let my legislative assistant know to go and help out when and where she can, and then promote that on social media. Something I think that we should all do, with
Yeah.
the following that we have. And if any of the media out there want to help promote this as well, that would be great. And then it just so happens I'm going to be in Lake Charles on November 2nd for the DOTD Roadshow, so I'll swing by there as
That'd be
well
great.
on the way out.
I-
But I view the staff shortage as one of, if not the largest issue, to your comments before. And so, these job fairs are a great step in trying to solve that, problem. So anything that we can do on our end to help promote that, I think that it's up to us
Yes.
to do that as well, as we share in this responsibility.
Thank you.
Thank you.
I think we have some social media.
I did see.
Positive, we
do
have
see.
some social media things we can send you just for you to retweet and stuff like. Perfect.
Yes. Senator Barrow?
Yes, really quickly. Thank you, Mr. Chairman. So I'm looking at the first bullet point here. There's bullet point that talks about looking at developing long and short-term statewide staffing recruitment strategies. And I see that you guys will kind of be reviewing this, seem like every other month. Can you kind of tell me exactly what you're looking for? Because as I look at your list, you're going to the end of the year. Are you guys planning on continuing doing this throughout next year of 2023? Is that part of the goal? And then as you're looking at your short and long-term goals statewide, what exactly are you looking to come from that?
So, just like this meeting, we are taking this really as a working document, and many of the things that we're doing are new, and so we're trying to see what comes of them. Or are they effective? Do we need to continue it? Is it something that we need to pivot from and make adjustments to? So some of them that may not carry out throughout the rest of this entire administration will be modified to carry out as we see the effectiveness. Others we may determine really we were not getting our bang for our buck there, and we need to do something different. So we really do expect this to be a working document and have it updated regularly for you all. And you know, some things may shift in that.
Okay, so as you guys are modifying the timeline that it takes to train them, the qualification, all those things, you'll be evaluating whether or not that's been effective.
Absolutely.
Okay, all right, thank
Very
you.
good. And, just from a time constraint, as we hit each letter, if there's no questions, a lot of this is self-explanatory, so we really don't need the, we really don't need the everybody to have the discussion. But I'll just kind of moderate it, and then if either side wants to say something, we go from there. But next thing is public outreach of advertising. It looks like you've got some social media, you're hiring events, you've got these things going on. Any questions on item B? Seeing no questions, we'll move to C. Hiring process improvement and simplifications. It looks like some things have already been accomplished, and it looks like from there internally your process is moving forward. Any comments from y'all in on that?
I do want to say how grateful we are to both civil service and the commission for staffing us up and giving us the extra people to be able to do this, because I know I sound like a broken record, but when the cuts came to the agency, they just weren't child welfare. We lost human resource staff. We lost staff everywhere. So having the ability to be staff plussed up a little bit from the division and civil services really helped.
So, Madam Secretary and your team, why don't we take just a little break from your side? And some of the committee members, I think, may want to just talk to civil service a little bit, so y'all can
Okay.
take just a little break. So any of the civil service team that's here, why don't we take that part of the conversation, and any of the committee members that have either some questions or an update, I think this bullet point is the right opportunity.
Senator Mills, as we move from the table, I also want to just state that Louisiana Workforce Commission has been an incredible partner with us as well. So Office of Technology Services, Louisiana Workforce Commission, Civil Service, the Commissioner's Office, all have been in lockstep with us for all of these hiring events. So,
And as you're talking it through, one of the bullet points were media exposure, IT exposure. Maybe it would make sense for the Senate and House team of IT to talk to your folks, and as you go to an area, they can message that out for you. So maybe that would be another opportunity.
Great, thank
I think Senator Barrow maybe had something before you guys.
Yeah, before y'all leave the table, on page 1, the first page of your strategies, under number 1, it's the second bullet. It says increasing pay, and then it has adding temporary pay options to immediately assist in retaining current employees. But then it say these tools will fall off in February.
Yes,
Is
ma'am.
that something that you guys can explain to civil service? Is that a part of what they are actually controlling here, or?
Senator Barrow, we had to go to the Civil Service Commission for those, and so, yeah, Civil Service is in
Okay then.
charge of that, and
Okay.
we went to the commission, and they are waiting for us to come back to say, how's it working, how's it going? That was just as far as they would go at
Okay,
that time.
thank you.
Senator Mills, if I could correct something that I said earlier, Senator Barrow, you will be happy to know. The MCOs are Aetna, Healthy Blue, and it is Louisiana Healthcare Connection, not United. I said United. It was Louisiana Healthcare Connection. That is the third one.
Okay.
And when it comes to that bullet point, I want to drill on that a little bit, so we'll talk more on that one. So civil service, I know y'all been very patient, and y'all can take a little leg break and stretch a little bit while we go to civil service.